Hi, my name is Jessica Smith. I'm the coordinator of the Support to Family Caregivers program at the YWCA Montreal. Our program offers individual counseling, group workshops and support activities, social and relaxation activities, as well as many other things to women who are caregivers. We also know, however, that there are many people who take care of someone or help someone out regularly and who don't consider themselves as caregivers. So whether or not you are a caregiver or consider yourself one, it can be very helpful to have information about what resources are available out there to older adults who have a loss of autonomy. The presentation you are about to watch is a condensed version of a conference that we have been giving all over Montreal in the past year and a half to help caregivers and older adults to understand the CLSC system and what services are available to them in order to help them stay at home as long as possible, as well as what other resources are out there to facilitate that choice of life. So this will stay available online for a long time. So if you don't have the time to go through the whole presentation in one sitting, there's no problem, don't worry. You can come back to it at any time. As well, there is going to be online with this presentation, a bank of resources and information that we have put together to go along with this for you to use. Okay? So before we get started, I just want to spend a minute talking about what a caregiver is. So I'd just like you to look at this slide. It asks a question about looking at different tasks and responsibilities that you might have for someone who is older, who has a loss of autonomy. So if you look at this list and you do any of these things regularly, so for example on a weekly basis, and it's somebody who depends on you to sort of do those things so they can manage and get through their days and their weeks. Even if you've only checked one thing on this list, you are in fact considered a caregiver. So what is a family caregiver? What does that mean? Basically, it's anyone who provides regular help to an older person who has a loss of autonomy and depends on them for that help. It's very important to understand that a caregiver does not by any means have to live with the person that they caregive for. It's also important to understand that it's more than just being in the regular role of daughter, son, partner. It really involves an extra set of responsibilities that you have to take on top of your regular role with that person and the roles that you have in your own life. So this help could be related to health needs, domestic tasks, legal and financial affairs, really anything that the person needs you to be doing for them because they can no longer do it for themselves. So now we will get into the conference topic, Navigating the System, Understanding the CLSC Services for Seniors. And just to be clear on what the goals of the presentation are, to understand the general structure of the system, which is pretty complex, the services in particular that are offered to seniors by the CLSC program aimed to help maintain people at home, and how to access these services. As I said before, we will also be providing information throughout on how to access and find other services when you need more help. So the structure of the system, what is a CUS? You may have heard this term before. Is this basically a superstructure that combines a bunch of other health and social services establishments that used to be on their own, that used to function independently, and now they are regrouped as of 2015 under this overall establishment. They include the long-term care facilities. So these are 3 different types of long-term care facilities: hospitals, rehabilitation centers, youth protection agencies, which don't apply to the presentation that we're talking about today, and CLSCs, which is what we will be talking about mostly today. This superstructure, when it came into play, and it's sort of important to understand that there are still effects of this going on today. The transition hasn't sort of settled in and been complete. People are still getting adjusted to the new structure and how it works. A lot of management positions were eliminated during this change, and so the work that was done by all these managers has to go somewhere. So there's a lot of people that are trying to renegotiate and figure out their new roles and their new workloads within this system. So there's a lot of after effects that are still going on. These are the territories in Montreal of the 5 CLSCs. So you can see on the map how the establishments within those colored territories are regrouped and which particular areas fall under which categories or under which CLSCs. So in this system, there are many different actors that provide services to seniors. I think we've had the expectation for a long time that the public system will be providing the services that we need as we get older and as our health begins to deteriorate. But in fact, it isn't exactly the case anymore, and it is probably going to continue moving in the direction that it's been going. So right off we start with the public system. This is the sort of rectangle in blue that we count on and expect to respond to our needs. Family doctors are part of that system, but now more and more we are the government is subsidizing family medicine groups. So these are private doctors that work for profit in their private clinics, but that are also receiving funding from the government, so that there's less drain on the public system, essentially, and that the people will be going to these clinics instead. There are benefits and drawbacks to this kind of system. This is a private-public partnership that they have. Certainly there's the hope that this will allow for services to be more accessible, more readily available. On the other hand, we could wonder about the effect that that has on the quality of service if people are profit motivated and trying to run through as many people in a day as possible. It's certainly not to say it's one or the other. It's just these are questions that we begin to ask as we see more and more of this public-private partnership going on in Quebec. The ministry also subsidizes community organizations to a certain degree to help fulfill the services that they need to provide. So again, rather than providing everything within the public system now, more and more they are looking to other actors to be involved to help provide those services, mostly because it's cheaper outside the public system to do so. And so it saves them a lot of money and provides services for the public at the same time. The problem with that sometimes being that the public isn't necessarily aware that this is what's going on. They're not necessarily aware that the public system doesn't provide everything that they need anymore, and that there are other actors that are involved that have to be turned to complement these services. Some of which you have to pay for, like domestic help social economy businesses that provide home care services. These are businesses that are not for profit, but they do charge, and any money that they do make is reinvested in the business. So they're not profit motivated, but they do cost money. And so these are services that can complement home care services offered by the CLSC, or if the CLSC is not involved, that people can pay for on their own, that the government subsidizes to help reduce the costs, but it still does cost something. So for some people it is still not necessarily feasible. There are of course also private agencies that you can pay to provide home care services to help maintain somebody at home. There are private long-term care facilities as well that complement and offer space for people that are not in the public system. And most importantly, and the purpose of all of what we're doing here is to talk about family caregivers. So family caregivers in Quebec actually provide 85% of the support and care that is necessary for people to stay at home when they are older and have a loss of autonomy. So 85% is a huge, huge amount. Basically, if you're looking at all those other actors on that on this slide, they are 15%, and the family caregivers carry the rest of the load. And so if you're a family caregiver and you're wondering why you might feel exhausted, why you might feel overloaded, well, that might contribute to answering that question. So today we're going to be talking about the CLSCs. as part of that whole system. And they are in relationship with domestic help social economy businesses, which I'm going to refer to as DHSEBs sometimes, private agencies, which provide home care services through the through a contract with the CLSC, and family caregivers, which of course are the most important element of all of that. So the CLSC services for seniors fall into two categories. One is the home care services, which you might also hear referred to as SAPA, which is the French term for the team. And these are the services that this team provides at home for people. The other side here we're looking at is general services. Those are services that CLSCs provide to the general public, which of course includes older people and caregivers. What's important to understand about the package of services that are offered by the home care services team is that it may differ from one CLSC to another. So while what you see here is in fact what is available in each CLSC, in theory, it doesn't mean that in practice or in reality that it's going to play out the same way in each place. So CLSCs have different demographics in their territories. They have different budgets. At different times of the year or from year to year, they may have a different level of need of the older people in their territory. So if one year they have a certain budget, and that year in particular there's a huge number of older people with high level needs, well, that budget's going to have to manage all of that. Whereas in another year, if the needs are not as high, they may have ability to give out more resources. So if you talk to a friend who lives in another area and you have a similar situation and you say, well, how come you're getting this many services per week or this many hours, and I have a very similar situation and I'm not getting that at all, this can help explain to why things are different from one place to another and from maybe one time to another. So now we're going to be focusing to start on the professional services available from the home care services team. There are a number of professionals involved in this team, and depending on what the seniors' needs are, several or more of them are going to be involved. So we'll start with looking at nursing services. Nurses will come to the home to help out with nursing care when necessary and when the person who needs that care is not able to go and get those services elsewhere from a nurse. So for example, it might be something that needs managing on a regular basis for a while, like a bandage change, or there might be injections that need to be done, things like that. And so the nurse will come to the home and do those things. What they do also, though, is a lot of teaching. So they will teach the caregiver or the person themselves how to manage a lot of those nursing care tasks on their own. And what's important to know about this is that it's not everybody that's comfortable doing that kind of thing. And so if at any point you are asked to do a nursing care task with which you are not comfortable, you have the right to say, I'm not comfortable doing this, I don't want to have this responsibility. Don't hesitate to say that and to express that need. You are not shouldn't be forced into a situation of doing nursing care that you're not comfortable with. Occupational therapy. An occupational therapist will come and evaluate a person's physical capacities in terms of their mobility, in terms of their ability to do the things they need to do in terms of their activities of daily living, getting dressed, getting up, stuff like that. So if they see that there is a lack of capacity in some area, they will again help the person themselves or the caregiver know how to do things differently to, for example, get up out of bed in a way that facilitates their mobility and deals with the problems that they have. Or it will involve adapting the home in order to facilitate the movements that they need to do. For example, in a bathroom, having a handle to get in and out of the bath. Just a simple example, or changing things on the floor so there aren't bumps to have to step over. A physiotherapist will also evaluate physical capacities of a person, but more in terms of after an injury or when there's pain, or in terms of just movement of the body. And the physiotherapist, rather than acting on the environment, will work more with the body itself, and so give people exercises to facilitate the movement or to recover after an injury or to reduce pain in a certain area. Nutrition services are with medical recommendation only, and a nutritionist can come and do a special diet plan or address the needs for swallowing of a person and put together something to address those kinds of needs. But again, it's really only in the case of a medically required intervention. End-of-life care, there are 3 types of end-of-life care that might be provided in the home. It's palliative care, ongoing palliative sedation, and medical aid in dying. So there are 3 different levels of care, ranging from just making a person more comfortable to rendering a person unconscious so that they don't have to feel what is going on anymore, or actually assisting them in dying. They all require medical recommendation. The latter requires a recommendation from 2 different doctors at 2 different times, and the person has to be completely cognitively apt in order to make that decision and make that choice at the time of when they would like to do it. Télésoins is another service that is provided but not by all CLSCs. I think in the future we're going to see this happening more and more as people, as they get older, are more and more comfortable still with technology. But it is a way for nurses to do to check in on a person and their health status without having to come directly to the house. So they'll use video conferencing to have nursing interventions. Medical services refer to when a doctor will come to the home to do a visit. And again, this is in only the situation where a person is completely unable to go out and see a doctor on their own. Social services are provided usually by a social worker. The social worker is the person responsible for case management. It's usually the pivotal person that does the communication between all of these other professionals on the team. She's also the person that will be, or she or he is also the person that will be responsible for any requests that need to be made, referrals, process steps, and checking in on the ongoing delivery of services and quality of services. On occasion, it is a nurse or an occupational therapist who may be the pivotal person in a case. That's in situations where there's more nursing care or there's more occupational care needs than other kinds, and so they will end up taking on that role. Otherwise, though, it is the social worker who is the case manager and responsible for all of those things. So now we're going to talk about domestic help services. So these include activities of daily living and domestic help services. So activities of daily living are more about what is involved for the person to just get through their day every day, getting up, getting dressed, eating, bathing, preparing for bed, those kinds of things. Domestic help services are more what's needed to manage the home. So cleaning, light repairs, doing housework outside or inside, running errands, those kinds of things that are required to just manage a household. So activities of daily living, the CLSC will provide assistance for these through the use of paid caregivers who could be working for any of the following places. So they could be working for the CLSC Home Care Services team, but more often than not, they are working for domestic help, social economy businesses, or for private agencies that have a contract with the CLSC Home Care Services team to provide those services. So as you see, what's important to know is that with those first 3 options, when the CLSC is providing the service through them or through contract, they are responsible. So if you have a problem with someone who's coming from an agency or a domestic help social economy business, it is still the CLSC that you need to call and that is responsible for managing those difficulties. Unfortunately, we hear a lot of problems from caregivers with these kinds of services, people coming late or not showing up, or just the fact that it's one caregiver one day and one the next and a different one the next, and that can be very difficult on a family or on the person that's being cared for. But if there are any unforeseen problems, like the person doesn't show up or isn't there doing what they're supposed to be doing, and it happens in the evening or on the weekend, you're left in a situation where you may have nobody to call or not know who to call. So to anticipate this can be important, asking your intervention worker from the CLSC, if this happens, who do I call, how do I get help? So have those names and phone numbers and their specific extension numbers, if you can, ready beforehand so that you know what to do in that case. Number 4 is talking about the direct allowance program, which is a program that the CLSC is encouraging more and more, that allows people to hire their own paid caregivers that come into the home, and that allows you more control over who's coming and whether or not you're satisfied with the service or not. It basically means you are the employer of that person, and that you manage all of that stuff on your own. The CLSC will pay directly that person for the number of hours that they have allocated in the plan. So all of this requires that an evaluation of the person's needs has been done by the CLSC, and they've decided how many hours of service of this kind you're entitled to have. It could also be a combination of these options, so it's not necessarily one or the other. Could be all of the above that you use. If the services that you get from the CLSC are not enough for your needs, or if you don't yet have services from the CLSC, it's also important to know that you can access these services on your own through private agencies or through the domestic help social economy businesses. But then, of course, you are paying for those services. Domestic help social economy businesses rates are lower because they are also subsidized by the government. As I explained before, the government wants people to be using these services. You can find out all about these domestic help social economy businesses on aidechezsoi.com/English, or EN for English. There is a link to this on our website in this with this presentation. We've put a number of different links to resources for you. So throughout the presentation I might be mentioning them, or if I've forgotten some you can check later. There may be even more than what I've mentioned during this presentation. Looking back at the domestic help now of the home care services section. Again, this depends on the needs that are established through the evaluation with the CLSC. And these are really a little bit harder to get access to because they're not as much the day-to-day functioning of the person kinds of needs, so there may not be as many hours allocated to these kinds of things. And again, you can get those services through private agencies and the social economy businesses. These kinds of services have very good subsidies from the government. For everybody, there's a $4 deduction off the cost no matter what. So whatever the price is that the social economy business says is the amount, everybody gets $4 off. And then according to your income, there is up to $10 further deductions that you can have off of the total price if you're low income. It's also important to know that there are some community organizations and some cultural organizations that may also provide assistance with these kinds of home care needs, either activities of daily living or domestic help. It's possible. For example, Meals on Wheels is a service you may already know about, which provides up to several meals per week for someone delivered to their door so that they are able to have their meal already ready if it's difficult for them to make them or prepare them or shop for them themselves. And we'll start talking about now end-of-life care, which I did mention before. So it was part of the professional services, but it's also here in this section as well. I won't go through that again. Technical devices. These are devices that somebody may need in order to manage, to get around, like for example, a hospital bed that helps somebody be adjusted in their bed and get in and out more easily, or a wheelchair, other things like that. These devices can be borrowed from the CLSC, depending on whether the CLSC has them available. So they may not have all devices that you might need, and they may not have the device you need at the time that you need it. So it is something to ask for and ask about. If the CLSC doesn't have it, the government has a program that provides subsidies or that covers the cost, in fact, of borrowing technical devices that you need, that you have a medical recommendation to have. And there's a really good website that helps you find the right retailer for the right device that you need. And you can find the link to that in our resource section. And there's also a link or a page that explains the program that the government has for doing this. So basically what it means is that if you need a device that is covered by the government, you have to get it from a specific retailer in order to have the government cover it. And it can't be just any device. You can't have the Wheelchair 3000 Super Express necessarily. If that's what you want, you will have to pay for that one yourself. So the CLSC is also one of 2 actors that are responsible for residential placement if you get to the point where this is something that you need or are considering. It comes either through the hospital recommendation or through the recommendation of the CLSC. And this recommendation gets sent to what's called in French the mécanisme d'accès d'hébergement, à l'hébergement. And this is basically the person responsible for evaluating these requests and orienting them to the appropriate place. So there are a number of different types of long-term care facilities that are available depending on the level of care, of medical care that a person needs each day. In a CHSLD, for example, it is when somebody needs 3 hours or more per day of medical care. That's where they would be oriented. If it's less than that, they would be oriented to one of these other 2 places. I'm not going to get into a big discussion about residential placement. It's a whole other presentation on its own. But just to explain that a family type resource is different than an intermediate type resource, which, as I said, are both with less hours of medical care, in the sense that a family type resource is more of a home environment rather than establishment type environment. So it's like sort of like a foster home situation. In Montreal, because we are talking about CLSC services in Montreal specifically, it's important to know that the wait list is very, very long, and the public resources just don't have enough beds for the real needs of the population. And so people are on waiting lists for these placements for quite a long time. It can be up to a year, up to 2 years at times. So if this is something that you foresee being necessary in the future, especially if it's in the near-ish future, it's time to start talking about it with your entourage, with the person that you care for, if that's appropriate, and with your CLSC worker. It doesn't mean taking steps and making decisions right away. It just means starting to have that conversation, because it's not an easy decision to make, and it does require quite a process in order to get into it. So start as soon as you think that might be something that's on the horizon. Now I'm going to talk about services to caregivers. So we're giving a presentation to caregivers for caregivers. So we'll talk a little bit about Respite for you. This is something that the CLSC will provide hours of service for. And it should really, really importantly depend on not just the needs of the person being cared for, but also on the needs and the situation of the caregiver. Both sets of needs should be taken into account when determining how much of these resources is allocated. So one of them is day center respite. This is when the person being cared for actually goes physically to an establishment where there are activities and services appropriate to their needs. And they stay there for the morning or for a day, and they get a chance to be with other people, do activities and socialize if that's something they want to do. And so CLSC like these options because it provides also something for the cared for person as well as the caregiver. There's also in-home respite. So this is when a person will come to the home and be present in the home so that the caregiver can leave and know that the person is safe and taken care of. So if you need those services on top of the services that you're already getting for the activities of daily living, it may be necessary to ask if you can have respite just for the sake of respite because your situation calls for it. There's also temporary respite, which is if you as a caregiver need a vacation or you have a health emergency and for a period of time you cannot provide the care that you usually provide, that the person really depends on to get through each day. So you can have the person placed in a long-term care facility for a brief period of time. So for example, for a few days, for a week, up to a maximum of 21 days. And you can do this a number of times in a year, up to a maximum of 63 days in a year total. So this is a service that you are able to use in the case of emergency or in the case of need for a break. Also, if you want to take a vacation, a much needed one, no doubt, you can use, if you are taking care of somebody who has Alzheimer's or another form of dementia, you can put your name on a list to have what's called the Baluchon Alzheimer in Montreal. This is a service that is available at $15 a day because it is subsidized by the government, where people will come to the house and take care of the person you're caring for 24 hours a day, for up to between 4 and 14 consecutive days. So this is an amazing service if you can get it. You do have to be out of the home, so you can't just use the service and stay home and sleep or rest or get things done. You have to really go. The idea is for you to take a break. On top of just providing the safety and the security and the service while you're gone, what's also great is that these people are trained to work with dementia, and they may be able, when you get back, to provide you with suggestions, with ideas about how to manage things or how to respond to things differently in a way that might help you in your role once you get back. There's also psychosocial support available to caregivers through the CLSC, but I'm going to talk about that in a minute because it comes through the general services. It's not offered through the home care services team. So support services or mental health services that are open to all, so this is available to you as a caregiver or to the person that you're caring for. In any CLSC, you can meet with a social worker or a social work technician by appointment or even walk in without an appointment for any number of different kinds of difficulties. So here's a very short, certainly non-exhaustive list of the types of issues that you might need to talk to somebody about. There are also, for caregivers, a number of community organizations in Montreal that provide support services, counseling, group support, and a number of other things. As I mentioned, our program here provides those kinds of services for women who are caregivers. We have partner organizations in Montreal that provide those services to both men and women. If you are looking to find support for yourself, you can, or for any questions related to your caregiving role, you can call the Caregiver Support Line at Appui, which is the Montreal organization that funds all of these organizations, and ask them explain a little bit about your situation, what you need, and where you live, and they will reroute you to the organization that can provide that for you in your area. So apart from psychosocial services and mental health services at the CLSC, also open to all are consultations with a nurse at every CLSC by walk-in or appointment. And then other services are available in only some CLSCs, so we'll just take a look at those quickly. There are many CLSCs that offer laboratory tests as part of their services. And then there are some CLSCs that have specific programs for certain chronic health conditions or specific missions. For example, the CLSC de la Montagne is associated with Caregiver, which is a social gerontology association. Now we're going to move out of what the services are that the CLSC provides into how you can access them. You need to start by calling the main number of the CLSC to make a request for service. It's really helpful to the intake person on the phone if you can be as specific as possible about what you need. What's also going to be critical is if it's possible in any way to have the person that needs the service themselves either be the person to call, or if they're not able to communicate that effectively, to be with you when you call, because unless they are willing to receive the services, the CLSC cannot provide them. So it's good for them to know right off the bat if that person is open to having the CLSC come and provide the services. If it is determined that the level of need is high enough, the CLSC home care team will accept you and will tell you that they will call, somebody from that team will call you back shortly to begin the process and to set up a home evaluation. Now that phone call will not come the next day. It's important to know that. It could take up to a week or two. Sometimes I've even heard 3 in order to get that call back. So it does go by urgency. So if your situation is less urgent, it will take a little bit longer. If it's more urgent, it will go more quickly. What that means, of course, is that in the meantime, while you're waiting for the call, if something changes and there's a rapid deterioration in the situation, you should call them back right away and let them know so that your place on the list changes according to your level of need. That being said, it's also really important then to get the phone number of the person you're supposed to call. Ideally, you don't want to have to go through intake again, and you want to call a person on the home care services team. So if you can get a number, a name, an extension of a person to call, that's the best way to prevent difficulties from coming up. Or if you feel like you've been waiting way too long and you're worried they've forgotten you, that's another reason to have that phone number that you can call and follow up. So what can you do to manage the situation that you're in? Either if the CLSC determines that you're not eligible for services, or while you're waiting for this home evaluation to be done. If you've made the call, obviously you're in need. Obviously the situation is getting difficult, and so you need to figure out how to get help in the meantime. You can ask the intervention worker that you're speaking to on the phone or the intervention worker from the home care services team when you do get that call back, what to do while waiting, who to turn to, what they could put in place maybe temporarily. They may or may not be able to answer those questions. It may be easier to call us or to call Appui, the caregiver hotline that I told you about before, to find out what resources are out there and how you can manage. On our website, along with this presentation, we have put together a sheet of phone numbers, contacts, information, resources in order to try and access whatever you can while you're waiting. There is a number in Montreal, 211, which you can call to access any community services in Montreal for whatever your needs are. So you can try that to look for resources. If you have healthcare questions that are non-urgent, you can always call 811 and find out from a nurse who is on the other end of the line, available to answer that phone 24 hours a day, every day of the year, to help out with medical questions and medical resources. So if you don't know where to go to get help for something medical, you can call them as well. 811 will also provide you with access to a social worker or a social work technician who can help you with psychosocial needs. So if you have that kind of need, that you can access someone there. There are also on that list that we gave you support lines, telephone support lines you can call just to talk to somebody if you need. As I said again, I can't impress it enough is to call if something changes in the situation, because the evaluation at home may take many months before it happens. It could take even up to a year in some cases, hopefully not, but there may be a long period of waiting before you get the services you need. So when somebody does finally come to the home and do the evaluation of the person's needs, they are going to be evaluating these 5 elements: activities of daily living and domestic activities, so the person's capacity to manage those things on their own, their cognitive functions, their physical capacity, so their mobility, and their ability to communicate. Once these are all evaluated, the process will also take into account any other vulnerability factors that that person is facing. What should also be happening during this evaluation is that the caregiver's situation should also be taken into account. So it's important for you as the caregiver to, if you can and you want to, be a part of this evaluation process to make sure that everything is being taken into account. Just recently, this evaluation form that they use has been modified, and caregivers are now incorporated into the process on that form. So you should be asked these questions now at this point formally. As I said, this is in transition, so it might be coming and might not have come into play in all CLSCs yet. So once this evaluation has been done, what will happen is that the social worker or the main intervention worker, whether it be a social worker or the nurse or the occupational therapist that are doing it, they will put together an intervention plan which will determine what the services are and how many hours of each service that a person is going to receive for their needs. Ideally, again, the caregiver should be involved in coming up with this intervention plan, and you shouldn't hesitate as a caregiver if you feel that what the services they are providing are completely inadequate based on the need that you see. It's really important to let that be known and to make your voice heard, respectfully, of course. But when the evaluation is done, it's one point in time, in one moment of this person's life and of your life with this person. It may not be representative in that moment of what every day is like. Very often a person will be in their best space and functioning at their best when the evaluation is done, because there's someone else in the home and it may not be your reality every day. And so that's information that's really important to let the social worker know, or let the person who's doing the evaluation know, so that they can take it into account. And if you just don't feel you can manage with the level of service that they're providing, you can let them know that you can't do it. And that's a very, very hard thing to say, especially as a caregiver who's used to giving and taking care of. But if you can't manage it, you're allowed to say that. You should say that. If you want to say that but you can't, call us. We'll help you figure it out. But really it's important to understand that you have rights within the system, and that you can have those rights respected and you can get help with them. So not sure if you heard me say it yet, that if there's any significant change in your situation, to let somebody know, and that this includes changes in the caregiver's personal situation or level of exhaustion. If there's nothing that's changed for the person who's being cared for, but some situation of the caregiver has changed and gotten harder to manage, that is equally important to let them know, to ask for more services if you need to. If you have any difficulty expressing your rights, advocating for your rights, or getting your rights respected, or the person who you care for's rights respected, there is assistance out there for that. We have a link on our website to an organization that is outside of the system that is trained in how to help you navigate that process if you need to do it and if you feel that you require assistance. So just to end, in terms of who we are and what we do, as I said again, we provide services to women who are caring for a senior, so someone 65 or older and who has a loss of autonomy. These are the types of services that we have: individual counseling, workshops of all kinds, workshops that are psychoeducational, workshops that are therapeutic, just presentations that we give. We also give presentations all over Montreal on different subjects about caregiving, about navigating the system, about how to preserve a caregiver's mental and physical health, about how to manage stress and anxiety, a number of different things. So we're available to come where you are. If there's a space and people wanting to hear, we can come to you, open to women and men in Montreal, and our services here are open to women. Our telephone line, if you call for information or resources or references, also available to anybody who needs. Once again, there is also Appui, the caregiver support line that you can call if we're not in your territory or don't have the services that are appropriate for you. Please let us know if you need anything.